Right now, as mop-up operations continue in KwaZulu-Natal, nursing union DENOSA is calling on government to prioritize the clearing of routes to healthcare facilities. This as access to healthcare facilities is hampered due to roads and infrastructure damage. For more on this, I'm joined now by Mbali Sabela, the acting secretary of DENOSA in KwaZulu-Natal. Mbali, good evening, and thank you for your time tonight here on In Focus. What is the current situation as far as health workers are concerned in eThekwini? One, in being able to get to work, but also in those who need medical attention right now, being able to get that in time.
Good evening, sir, and thank you very much. The situation is very bad down there in Devon, especially around Devon and places around Devon, because some of the nurses, they can't get to work, and those who are at work, they hardly get home. They get stuck to the traffic for more than 5 hours trying to get to work or trying to get home. The situation is the roads are bad, the bridges have fallen apart, so there is this disconnection between the community and the healthcare facilities. Yeah. Very, very difficult for them.
And what are the communities saying, man? What is the likelihood that there are people currently who are suffering some kind of emergencies that need urgent help? And how are they getting help? How are they getting to health facilities?
It's very difficult. They're using their public transport, and then some they carry each other. Remember, if there's a bridge that is broken down, you need to walk on barefoot to get to another road where you get another transport, a train transport that will take you to the health facilities. Even the ambulances, they can't get out from the health facilities to go to the community to pick them up. So it's very difficult for them to get to the health facilities. And we are pleading with the government so that they can maybe try to have mobile clinics or mobile cars that will go to the public. Because if the public can't get to the health facilities, the health facility or the health care, the care workers, they must try to get to the community to give them their medications. But then at the same time, it's difficult for healthcare workers because we are short-staffed. We don't have that capacity to have nurses in the facility and nurses to go on mobile clinics. Yes. So it's very, very difficult at the moment to say exactly how can we move forward. We wish they can prioritize to clear out the roads, because some roads just need to be cleared out, to be removed, remove the sand that is on the road and move those distractions that are on the road. That maybe it will be easy for people to walk around, because even our clients or our members, they can't get to their facility to work. Even if they want to go to work, they must carry at least 5 or 6 hours. Then at what time must you wake up to go to work? It's very, very difficult and very frustrating for our members.
Now, as DENOSA, I'm sure you were listening to the Premier earlier on talking about certainly there's work that's being done, but it's becoming clearer and clearer that they need a little bit more capacity. In fact, he was calling for more excavators and such equipment to be able to help them with the mop-up and clean-up operation. Have you engaged the Department of Health in the province around these issues, and what is the response that you're getting?
We have tried to engage with the Department of Health, but then we understand that they are busy visiting the areas that were affected, because we even try to be part of those visits so that we can go with them to see. But then we hope that when they get time, they will engage with us, because we really need to sit down and to see how can we plan this. Because as I'm speaking to you, we have already lost a member who was working in Coast Albert due to these floods. Her house was destroyed. And we have a member at Meran Hill who her house was destroyed. She doesn't have a place to stay at the moment. It's engaged with the department or with the institution to accommodate her until everything is cleared. And we are calling for everybody who can help in this situation, because it's not for the department only or for government only. Even the NGOs, they must come on board to assist the situation, because the situation is bad there on the ground.
But what are your colleagues telling you about the impact of broken down infrastructure? Has this had some kind of impact, especially on hospitals? So electricity currently that is not working in some parts, and water that is not flowing in some parts. Has this had any impact on the delivery of health services?
Some of our members, they couldn't go to work because there is no water, there's no electricity. Then they are asking us, how am I going to prepare myself to go to work? And then some of our members, they can't even notify the institution that they are still alive or they are well where they are, because there's no network where they are. So the situation is very bad in such a way that you don't know who is where doing what exactly. Due to the network problem, we can't communicate with each other, but our members, we are trying to communicate with them via who you know, and then visiting those who are close to each other so that they can report back to us. We only get network if we are standing somewhere, if we are going somewhere, but if we are from their own comfort of their home, of which is flooded with water, they can't tell us exactly what is going on. So we relying on our shop steward on the ground to inform us what is going on. It's very difficult to with these two basics, which is water and electricity. It's very difficult to live without it. So it's very difficult out there. I don't want to lie to you. I wish we can get at least water being fixed as soon as possible, because even at the public spaces, there's no water. It's very difficult even to go there and do your normal shopping because there's no water.
Yeah. I must tell you, we are of course trying to reach out to the MEC for health in KwaZulu-Natal, unable to at this particular point in time. But what are you hearing as far as health facilities are concerned? Are some healthcare facilities affected by the damage to infrastructure?
Yes, as I'm talking to you, the Nanda Newtown Clinic, it's still closed, but then others are operating with a skeleton staff, of course. And then some facilities where they have a poor drainage system, of which that's why the water was flooding over the building. But then they try to remove the water, and then it's back to normal. It's a lot of institutions. It's only one institution that is not open at the moment. So the other institutions are working properly. It's just that they don't have enough staff to operate. And then there's this connection between the public and the health facilities because of the roads.
So as DENOSA, what are you calling for? If there's one thing that you would want the government to prioritize at this particular point?
It's to take care of those who are affected, and also to prioritize to make sure that they beef up the staff, and then they try to accommodate the staff in such a way that those who are within the institution are accommodated, and then given all the needs they need. And then they make sure that they beef up with the staff, that maybe for the particular time they hire certain staff for the particular time to cover up for those parts of staff that is affected. Because if your house was demolished, you are not expected to come to work today. You need some time to sort out your house in order. So they need to make sure that they clear out the road and then beef up the staff with the temporary staff if they can, and then they try to sort out the issue of water and electricity.
Mbali Sabela, I appreciate your time. Thanks for coming on, Acting Secretary of DENOSA in KwaZulu-Natal.